Today we will discuss about some renal disease, congenital anomalies of kidney. The most important one is absent of one kidney. It accidentally discovered on ultrasound, IVU or CT scan. In that case, contralateral kidney will be hypertrophied. Another is horseshoe kidney. Horseshoe kidney, usually lower pole, are fused with junction in front of L4 vertebra. So lower pole will be fused with junction in front of L4 vertebra. And ureter pass in front of the fused lower pole. This is important. Ureter pass in front of the fused lower pole. And one interesting case is on IVU, intravenous ureteroscopy, lower pole calyces on both sides are directed towards the midline. Lower pole calyces of the both sides directed towards the midline, and ureter have flower vase-like curve. Flower vase-like curve. So in NEET, it will be asked that flower vase-like curve found in which condition? So this is horseshoe kidney. Flower vase-like curve, most common in man. So next is crossed dystopia. Crossed dystopia is unilateral fusion. Both kidneys are in one loin and usually fused. Maybe unilateral long kidney or unilateral S-shaped kidney. Depends on the type of fusion. Ureter of the lower kidney crosses midline to enter bladder on the contralateral side. So crossed dystonia means both kidney are in the same loin. Now another condition is duplex renal pelvis. Duplex renal pelvis means that is the most common abnormality of upper renal tract. Usually unilateral and more common on left side. Duplex renal pelvis. Okay. Next is, now this is very important, that in there is a drooping lily sign. So drooping lily sign on IVU in duplex renal collective system. In question, NEET question, they asked that drooping lily sign found in which condition? So duplex renal pelvis, you get drooping lily sign. Now in case of duplex ureter, ureter often join दो ठो ureter होगा, एक upper pole एक lower pole ureter. So ureter often join before they reach the bladder and open by a common ureteric orifice. They may also open independently. So duplex मतलब दो ureter रहेगा, एक ही किडनी में दो ureter, upper में रहेगा एक lower में रहेगा. In female, ectopic ureter opens either into the urethra below the sphincter or into the vagina, causing incontinence. That is very important. So incontinence in case of female, it may be due to duplex ureter. So this is important. But in male, the aberrant opening is above the external urethral sphincter, so that the patient is continent, not incontinence. Okay. There is a rule, Waite-Mayer rule. In Waite-Mayer rule, says that upper pole ureter insert medially and inferior to lower pole ureter. Upper pole ureter insert medially and inferior to lower pole ureter. This is Waite-Mayer rule. So duplex ureter. Now another is this ureterosil. Ureterosil. It is more common in female. Cystic enlargement. This is very important. In NEET question, there may be asked another sign in IVU. So cystic, more common in female. Cystic enlargement of intramural portion of the ureter. Intramural portion of the ureter through the result from congenital atresia of ureteric orifice. So in the insertion of the bladder, when intramural, there may be congenital atresia of the ureteric orifice. So there is enlargement, cystic enlargement. In IVP, we saw cobra head appearance. Cobra head appearance is very important. Again, NEET asks that what is cobra head appearance? In which condition you get cobra head appearance in IVU? So it is ureterosil. In the X-ray, it is classical chain, but you see the X-ray picture there. So these are the more common causes of this congenital anomalies. Now, another most important thing is that there may be polycystic kidney. Polycystic kidney may be childhood kidney or there may be adult polycystic kidney. Now, one interesting case, I am just treating a case. A patient, a lady of 40 years, she has repeated urinary trouble, and he consulted different urologists in different places, even in Vellore. One kidney, there is polycystic kidney in the left kidney. So they diagnose it as a polycystic kidney, adult kidney, and they suggest that you must do the renal transplantation or nephrectomy. You must do nephrectomy in case of this series. So they come with me. पेशेंट बहुत इंटरेस्टिंग है. लेडी अब से 10 साल से वो सफर कर रही है. वो पॉलिसिस्टिक लेफ्ट साइडेड किडनी डिजीज में. उसका हमने एक्सरे देखा तो काफी उसका सिस्ट भरा हुआ है और उसको उस किडनी हाइड्रोनेफ्रोसिस थोड़ा सा इनलाज हो गया. बाकी किडनी नेक्स्ट जो किडनी है वो भी थोड़ा डिजीज है, 50% काम कर रहा है. बट उसका जितना भी पैरामीटर्स था डायग्नोसिस सबने हमने फिर से रिपीटेड टेस्ट कराते हैं, अल्ट्रासोनोग्राफी हर महीना में कराते हैं. तो उसमें हमने देखा कि पेशेंट इज इम्प्रूविंग. सो उसका जो जितना भी पैरामीटर्स है सब नॉर्मल पोजीशन में आ रहा है. तो उसको धीरे धीरे करके बोला कि सर हम अवॉइड करते हैं कि हम नेफ्रेक्टोमी नहीं कराएंगे, तो वो कम कर रहा है. तो दिस इज वेरी इंपॉर्टेंट. सो लेट अस कम विद द पॉलिसिस्टिक किडनी. सो इट मे बी पॉलिसिस्टिक चाइल्डहुड किडनी और एडल्ट पॉलिसिस्टिक किडनी. So in childhood kidney, it is autosomal recessive. It is autosomal recessive and gene responsible for it at chromosome 6p in case of child, but adult it is chromosome 16p. Chromosome 16p gene on chromosome 16p. So in case of adult polycystic kidney, 16p gene defect, PKD1 and PKD, which code for polycystin 1 and 2. So phenotype heterozygosity is the hallmark of ADPKD, as evidence on family member who share the same mutation but have a different clinical course. So there may be another candidate, another member of the family, they may suffer from polycystic kidney. So this is the phenotype. Now, coming to the childhood polycystic kidney. So it is chromosome 6p and clinically diagnosed in the first year of life, presenting as bilateral abdominal mass. So first year of life, presenting as bilateral mass. Enlargement with small cyst less than 5 millimeters, limited to the collecting tubule. Death in neonatal period is most common due to pulmonary hypoplasia. Hypertension occur in the first few years of life, and if patient survive, then portal hypertension, esophageal varices, hypersplenism from periportal fibrosis may occur. So there may be some associated abnormalities in congenital cystic. Now, congenital hepatic fibrosis and maternal oligohydramnias, these are the symptoms. In case of adult, it does not manifest before 30 years. So this is important. In case of adult polycystic kidney, it does not manifest before 30 years. Manifest disease may be rhinomegaly, flank pain, hematuria, infection, hypertension, and uremia. So these are the things you may come across this. Now, most common extrarenal anomaly is hepatic cyst. For your information, this lady also suffered from single hepatic cyst, and they diagnosed ultrasonography that it may be due to hydatid cyst or this, but there is no evidence of hydatid cyst there. So also cyst may occurs in spleen, pancreas, or ovaries, and there may be intracranial berry aneurysm. In that case, हो सकता है berry aneurysm. So in IVU, spider leg deformity is very consistent finding. Spider leg deformity. And before the age of 30 years, it can maybe some more sensitive for detecting the pre-symptomatic disease. So दो डिजीज में मेरे को, एक चाइल्डहुड एक एडल्ट. इन चाइल्डहुड क्रोमोसोम 6p, इन एडल्ट 16p, क्रोमोसोम 16p. Another difference is in first year of life, patient may not survive. There may be pulmonary hypoplasia and associated with congenital hepatic fibrosis. But in adult type, there may be, it doesn't manifest before 30 years, and there may be renal kidney enlargement of the kidney, flank pain, hematuria, infection, uremia, or etc. Now, hepatic cyst, most common extra-renal anomaly, and there may be intracellular barium. Patient may die due to intracranial barium rupture. And most common consistent finding in IB is spider leg deformity. Spider leg deformity is very common. So these two conditions is very important. Okay.
Yes. This was asked in the question like
Yes,
few years
yes.
back. It was very common.
Common ask that what is the spider leg deformity found in which condition, and this drooping lily sign condition and cobra head found in which condition. ठीक है.
They all are image based question actually.
Yes, very important. फ्लावर वेस्ट लाइक बच्चे में मिलता है. तो 4 कंडीशन बहुत इंपॉर्टेंट है. 1-2 क्वेश्चन तो आ चुका है कि फ्लावर वेस्ट लिली फाउंड इन विच कंडीशन. अनदर इज कोबरा हेड इज इंपॉर्टेंट है. कोबरा हेड किस में मिलता है, ठीक है, और ड्रूपिंग लिली साइन किस में मिलता है. इस सब चीज को आपको जानना जरूरी है. ठीक, ओके. So let us come to point. One is the most common tumor, Williams tumor. Okay, Williams tumor is a renal malignancy of early childhood, 2 to 4 years age. Okay, Williams tumor syndrome. There are 2 different types of syndrome. Histology, if this tumor is very important. This tumor display a classic triphasic histology. क्लासिक ट्राइफेजिक हिस्टोलॉजी 3 फेजेस में होता है. वन इज ब्लास्टिमल, स्ट्रोमल एंड एपिथेलियल फीचर्स. Triphasic histology, this is very important. It may be question asked that in which condition you get triphasic histology, is which tumor. So these blastomal, stromal and epithelial features all present in Williams tumor. Huge palpable flank mass, hemihypertrophy, hematuria, and hypertension presenting features. Diagnosis confirmed by CT ultrasound or confirmed by excisional biopsy. So treatment transabdominal nephrectomy, and it is Williams tumor is highly radiosensitive. So this post-operative radiotherapy should be given within 10 days after surgery. So important of Williams tumor is that it is triphasic histology. Most commonly occurs between 2 to 4 years of age. Now, another condition is neuroblastoma, which may confuse with Williams tumor. So, what is neuroblastoma? It is most common tumor of adrenal medulla, but can occur anywhere along sympathetic chain. It affects less than 2 years of age. Risk factor may be an MIC oncogene, neurofibromatosis, tuberous sclerosis, pheochromocytoma, or Hirschsprung disease. Hirschsprung disease is also a neurological defect in the gut colon. Previously, I told about Hirschsprung disease. In that case, although myenteric and Meniscus plexus both absent, so ganglion layers is absent, Meniscus and myenteric plexus. Now, so these are the all common causes. Now, clinically, where there may be abdominal mass, hepatomegaly, leg edema, hypertension is very common, less common. Hypertension is very less, and periorbital bruising. Periorbital bruising is important. So, neuroblastoma. In 90% of cases, elevated catecholamine, there is HBA, dopamine, homovalenic acid, valenic mandelic acid are found in the urine and blood. So, there is more degradation of catecholamine and dopamine. These are found 90% cases. Treatment is localized tumor with excision. Chemotherapy and radiotherapy can be used. So, it good prognosis if you diagnose less than 1 year of age. Now, one is SIMADA histological classification. SIMADA, SIMADA, SIMADA. SIMADA histological classification is used for the prognostic value. It is nothing but 3 types of. One is undifferentiated, second is poorly differentiated, and third is differentiated, very much differentiated. So in very much differentiated, good prognosis, undifferentiated is less prognosis. So it is CIMADA histological classification. It may be asked that which condition we get CIMADA histological classification. So this is neuroblastoma. So difference between two things, Wilms tumor and abdominal neuroblastoma. Very important, you have to diagnose. So age of onset 2 to 5 years in Wilms tumor, less than 2 years, 30% under 1 year in case of neuroblastoma. Health is well in Wilms tumor, but here is lethargic, it feeling ill. Clinically, swelling abdomen, pale, weight loss, diffuse bone pain in case of neuroblastoma. And mass is lobulated. Mass lobulated in Wilms tumor, and in neuroblastoma, it is irregular age, or midline may be crossed in common in neuroblastoma. Bilateral rare, both cases. And calcification is very important. Calcification, 10% cases of Wilms tumor, there may be calcification, but very common, 90% cases calcification occurs in neuroblastoma. So it examination may be asked that 90% calcification is found in which tumor, Wilms tumor or neuroblastoma. So calcification is very common in neuroblastoma. And metastasis, Wilms tumor may be in lungs, and in case of neuroblastoma, it is bone orbit calcically.
Yeah.
So
It's
it is
actually
important.
can be given as a one-liner. मतलब अगर true or false sentence में which of the following sentence is false, उसी हिसाब से वो
Yeah.
बना सकता है क्वेश्चन बनाने का तो डिफरेंट टाइप्स ऑफ क्वेश्चन आता है वही.
Yes, yes, yes. So the most common pediatric malignancy, first leukemia, second brain tumor, and third lymphoma. This is कुछ हट के ही हम बोल रहे हैं. Most common pediatric malignancy, first leukemia, second brain tumor, and third lymphoma. So today we
ओके
wind up here.
ओके पर तो आज पीडियाट्रिक ट्यूमर्स किडनी रिलेटेड जितने भी प्रॉब्लम्स थे सब कुछ डिस्कस हो गया. तो
हो गया.
ये मतलब पूरा सीरीज जो है ना उसको पॉडकास्ट के रूप में मैंने यूट्यूब में डाल दिया था. तो लोग उसको
Yes.
इवन जो ऑडियो को डाउनलोड करके भी सुन सकते हैं लाइक कभी वॉक कर रहे हैं या कुछ कर रहे हैं. तो वीडियो तो है ही ऑलरेडी, ऑडियो के फॉर्मेट में भी वो लोग सुन सकते हैं. सो उनके लिए मतलब दे आर वेरी गुड. मैं स्टूडेंट्स को बताऊंगा कि यू कैन गो फॉर इट लाइक ऑडियो. विजुअल का तो है ही अलग से आदमी देख रहा है क्योंकि हम लोग के पास तो कोई चार्ट इस तरह का है नहीं. तो उनको इसलिए
Yes.
चाहिए कि भाई नहीं ठीक है आप ये करिए कि कम से कम ऑडियो उसको सुनिए. तो आपको एक बार में क्या होगा कि बहुत सारा चीज दिमाग में आ जाएगा.
आ जाएगा. हाँ.
बहुत सारे क्वेश्चन रिकैपिचुलेट, हाँ एक सीरीज की तरह हो जाएगा एक के बाद एक के बाद एक. पीडियाट्रिक्स के बाद पापा सीधा मेडिसिन पे ही उतरेंगे. पीडियाट्रिक्स कंप्लीट होने के
Yes.
बाद तो मेडिसिन के एक एक
Okay.
सिस्टम करके कंप्लीट करते चल जाएंगे. ओके
ठीक
पापा.
है.
ठीक है.
Okay.